Taking care of your mental and physical health is important to achieving what you want in life. Certainly, when you are sick, you have only one desire: to be healthy. When we think of the deadliest diseases, our minds probably jump to the fast-acting, incurable ones that grab headlines from time to time, or we might be inclined to imagine the ones with visually severe symptoms that grab the headlines for their rapid spread and lives lost. On the contrary, many of the diseases that have those characteristics don't kill as many people as we believe, not even ranking among the top causes of deaths worldwide. It turns out that the deadliest diseases are those with a slow progression. According to the World Health Organization, WHO, out of 56.9 million deaths worldwide in 2016, more than 50% were caused by the top deadliest diseases. Ischemic heart disease and stroke are among the biggest killers. These diseases remain the leading causes of death globally over the past 15 years. Unlike the diseases with a rapid spread and disastrous consequences, the deadly diseases that progress slowly can be monitored and controlled. With the right diagnosis, preventive care and advice from healthcare providers, patients can take steps to lower their risk of fatal consequences. Even some diseases can be cured with the use of today's most modern techniques and technologies. Here are the top diseases most dangerous to modern humans today, and these are also the top diseases that kill the most people worldwide every year, according to the World Health Organization, WHO. 1. Coronary artery disease. The deadliest disease for modern humans currently is coronary artery disease, also known as ischemic heart disease. Ischemic heart disease, also called coronary artery or heart disease, is the leading cause of death worldwide, according to the World Health Organization, WHO. Ischemic heart disease and stroke accounted for a total of 15.2 million deaths in 2016. Some studies show that 90% of people have at least one risk factor for heart disease. It's vital to remember that heart disease is the leading cause of death for both men and women. When a person's blood vessels narrow due to damage, they are at serious risk of heart disease. Symptoms include arrhythmias, chest pain, and heart failure. You are at risk for heart disease if you have one or more of the following factors: high blood pressure, high cholesterol levels, smoking, family history of coronary artery disease, diabetes, being overweight. Fortunately, due to improved science, medical care and education, death rates due to coronary artery diseases have declined, even though it remains the #1 killer. Coronary artery disease can be avoided by maintaining a lifestyle that encourages good heart health. To decrease your risk, follow these tips: exercise regularly, maintain a healthy weight, eat a balanced diet low in sodium and high in fruits and vegetables. Avoid smoking. Drink alcohol in moderation. Please talk to your doctor if you have one or more of these risk factors. 2. Stroke. A stroke can happen when an artery in the brain gets blocked or leaks. Your brain will then be deprived of oxygen and cells will begin to die within minutes. Symptoms of a stroke include numbness in parts of your body, trouble walking or seeing, and confusion. It's possible to recover from a stroke, but if left untreated, it can cause long-term disability. Getting treatment within 3 hours of experiencing a stroke lessens the likelihood of long-term disabilities. But according to the U.S. Centers for Disease Control and Prevention, CDC, while 93% of people know that sudden onset of numbness is a sign of a stroke, only 38% are familiar with the other stroke symptoms. Hence, stroke remains the leading cause of long-term disabilities. Risk factors for stroke include high blood pressure, family history of stroke, smoking, especially when combined with oral contraceptives, smoking, diabetes, brain aneurysms or arteriovenous malformations, age and gender. Some risk factors of stroke can be reduced with preventative care, medications and lifestyle changes. In general, good health habits can lower your risk. These include controlling high blood pressure, exercising regularly, eating a healthy diet low in sodium, avoiding smoking, drinking alcohol in moderation. 3. Lower respiratory infection. A lower respiratory infection is an infection in your airways and lungs. It can be due to influenza or the flu, pneumonia, bronchitis, tuberculosis. Viruses usually cause lower respiratory infections. They can also be caused by bacteria. Coughing is the main symptom of a lower respiratory infection. You may also feel breathlessness, wheezing, and a tight feeling in your chest. Untreated lower respiratory infections can lead to breathing failure and death. Risk factors for lower respiratory infection include the flu, poor air quality or frequent exposure to lung irritants, smoking, a weak immune system, crowded childcare settings, which mainly affects infants' asthma, HIV. One of the best preventative measures you can take against lower respiratory infections is to get the flu shot every year. People at high risk of pneumonia can also get a vaccine. Wash your hands regularly with soap and water to avoid transmitted bacteria, especially before touching your face and before eating. Stay at home and rest until you feel better if you have a respiratory infection, as rest improves healing. 4. Chronic obstructive pulmonary disease, COPD. The third leading cause of deaths worldwide is COPD, or chronic obstructive pulmonary disease, an umbrella term for progressive lung diseases. Chronic obstructive pulmonary disease, COPD, is a long-term, progressive lung disease that makes breathing difficult. Chronic bronchitis and emphysema are types of COPD. According to statistics, the number of people with lung cancer accounts for about 13% of all cancer patients worldwide. In 2012, about 1.83 million people had cancer worldwide. Researchers estimated that about 1.59 million people died from this fatal disease, of which 354,000 in Europe, 35,400 in the UK alone. By 2021, up to a third of all cancer deaths in the US are due to lung cancer, about 158,000 people. In North America alone, up to 45% of lung cancer patients are women, and the number of patients dying from this disease exceeds the number of people dying of breast cancer. The number of deaths from lung cancer in the world is equal to that of colon, breast and prostate cancer combined. This disease accounts for only 13% of all cancers, but the death rate is 28% among all cancers, and especially lung cancer is the type with the highest mortality rate. Risk factors for COPD include smoking or secondhand smoke, lung irritants like chemical fumes, family history, with the AATD gene being linked to COPD, history of respiratory infections as a child. There's no cure for COPD, but its progression can be slowed with medication. The best ways to prevent COPD are to stop smoking and to avoid secondhand smoke and other lung irritants. If you experience any COPD symptoms, getting treatment as soon as possible increases your outlook. 5. Respiratory cancers. Respiratory cancers include cancers of the trachea, larynx, bronchus, and lungs. The main causes are smoking, secondhand smoke, and environmental toxins. But household pollution such as fuels and mold also contribute. A 2015 study reports that respiratory cancer accounts for about 4 million deaths annually. According to WHO, cancers of the trachea, bronchus, and lungs are 6th on the organization's list. Lung cancer specifically is the leading cause of cancer deaths in the United States, among both men and women. Although it is closely associated with smokers, even non-smokers are at risk for developing lung cancer. Trachea, bronchus, and lung cancers can affect anyone, but they're most likely to affect those who have a history of smoking or tobacco use. Other risk factors for these cancers include family history and exposure to environmental factors, such as diesel fumes. The most obvious method of prevention is to stop smoking, or not starting. Apart from that, there isn't much that can be done to specifically arrest the development of this disease, except to minimize your exposure to a poisonous environment. You can also use an air purifier in your home and office, and wear a mask when going outside in poor air quality conditions. Early detection can save you from experiencing the very worst symptoms of respiratory cancer. 6. Diabetes mellitus. Diabetes-related deaths were the 7th most common worldwide in 2016. People in low to middle-income countries are more likely to die of complications from diabetes. Diabetes is a group of diseases that affect insulin production and use. In type 1 diabetes, the pancreas can't produce insulin. The cause isn't known. In type 2 diabetes, the pancreas doesn't produce enough insulin, or insulin can't be used effectively. Type 2 diabetes can be caused by a number of factors, including poor diet, lack of exercise, and being overweight. If not properly controlled, patients die from complications due to diabetes. Diabetes is not reversible unless you catch it in the early stages. You can only manage the symptoms and make lifestyle changes. Risk factors for diabetes include excess body weight, high blood pressure, older age, not exercising regularly, an unhealthy diet. While diabetes isn't always preventable, You can control the severity of symptoms by exercising regularly and maintaining good nutrition. Adding more fiber to your diet can help with controlling your blood sugar. Check in with your doctor every 2 to 3 months to discuss blood sugar control, medication dosage, and any new developments in diabetes management. 7. Alzheimer's disease and other dementias. Although this progressive disease isn't always a direct cause of death, Alzheimer's does contribute to other factors that shorten people's lives or cause deadly complications, and the disease is fifth on WHO's list. When you think of Alzheimer's disease or dementia, you might think of a loss of memory, but you might not think of a loss of life. Alzheimer's disease is a progressive disease that destroys memory and interrupts normal mental functions. These include thinking, reasoning, and typical behavior. Alzheimer's disease is the most common type of dementia. 60 to 80% of dementia cases are in fact Alzheimer's. The disease starts off by causing mild memory problems, difficulty recalling information, and slips in recollection. Over time, however, the disease progresses and you may not have memory of large periods of time. A 2014 study found that the number of deaths in the United States due to Alzheimer's may be higher than reported. Risk factors for Alzheimer's disease include being older than 65, a family history of the disease, inheriting genes for the disease from your parents, existing mild cognitive impairment, Down syndrome, unhealthy lifestyle, being female, previous head trauma, being shut off from a community or having poor engagement with other people for extended periods of time. There's not currently a way to prevent Alzheimer's disease. Researchers aren't clear why some people develop it and others don't. As they work to understand this, they're also working to find preventive techniques. One thing that may be helpful in reducing your risk of the disease is a heart-healthy diet. A diet that's high in fruits and vegetables, low in saturated fats from meat and dairy, and high in sources of good fats like nuts, olive oil, and lean fish may help you reduce your risk of more than just heart disease. They may protect your brain from Alzheimer's disease, too. 8. Diarrheal diseases. Diarrhea is widespread in developing nations with poor sanitary conditions, but you can develop diarrhea anywhere in the world. Diarrhea is when you pass 3 or more loose stools in a day. If your diarrhea lasts more than a few days, your body loses too much water and salt. This causes dehydration, which can lead to death. Diarrhea is usually caused by an intestinal virus or bacteria transmitted through contaminated water or food. It's particularly widespread in developing nations with poor sanitary conditions. Diarrheal disease is the second top cause trusted source of death in children younger than 5 years. About 760,000 children die from diarrheal diseases each year. Risk factors for diarrheal diseases include living in an area with poor sanitary conditions, no access to clean water, age, with children being the most likely to experience severe symptoms of diarrheal diseases, malnourishment, a weakened immune system. According to UNICEF, the best method of prevention is practicing good hygiene. Good hand-washing techniques can reduce the incidence of diarrheal diseases by 40%. Improved sanitization and water quality as well as access to early medical intervention can also help prevent diarrheal diseases. 9. Tuberculosis, TB. TB is a lung infection caused by an airborne bacteria called Mycobacterium tuberculosis. This bacterial disease typically infects the lungs, but it can also affect other areas of the body, including the brain, skin, and abdomen. Although pneumonia is more common in the United States and Canada, tuberculosis is more common in low-income countries. It is particularly hard to treat, especially in these resource-poor countries, which likely contributes to its ranking as one of the world's deadliest diseases. The regimens necessary to treat this easily transmissible disease can be challenging to develop and follow. In addition, the vaccine, which isn't widely used in the United States, doesn't always protect against TB. Although it is treatable, some strains are tough enough to not respond to conventional cures, and it is one of the main causes of death in HIV/AIDS patients. Those at risk of developing tuberculosis include those with low body weight, HIV infection and diabetes, and those on medicines like corticosteroids or immune system suppressors. Since 2000, however, the number of TB cases have fallen by 1.5% every year. The goal is to end TB by 2030. Risk factors for tuberculosis include diabetes, HIV infection, a lower body weight, proximity to others with TB, Regular use of certain medications like corticosteroids or drugs that suppress the immune system. The best prevention against TB is to get the Bacillus calmette-guérin (BCG) vaccine. This is commonly given to children. If you think you've been exposed to TB bacteria, you can start taking a treatment medication called chemoprophylaxis to reduce the likelihood of developing the condition. 10. Cirrhosis. Cirrhosis is the result of chronic or long-term scarring and damage to the liver. The damage may be the result of a kidney disease, or it can be caused by conditions like hepatitis and chronic alcoholism. A healthy liver filters harmful substances from your blood and sends healthy blood into your body. As substances damage the liver, scar tissue forms. As more scar tissue forms, the liver has to work harder to function properly. Ultimately, the liver may stop working. Risk factors for cirrhosis include chronic alcohol use, fat accumulation around the liver, non-alcoholic fatty liver disease, chronic viral hepatitis. Stay away from the behaviors that can lead to liver damage to help prevent cirrhosis. Long-term alcohol use and abuse is one of the leading causes of cirrhosis, so avoiding alcohol can help you prevent damage. Likewise, you can avoid non-alcoholic fatty liver disease by eating a diet that's healthy, rich in fruits and vegetables, and low in sugar and fat. Lastly, you can reduce the likelihood of contracting viral hepatitis by using protection during sex and by avoiding sharing anything that could have traces of blood. This includes needles, razors, toothbrushes, and more. We have just told you about the top diseases that are most dangerous to modern humans today. Sickness does not rule out anyone. Any of us can develop one of these diseases in a lifetime. Therefore, it is extremely important to know early to prevent and minimize the risks of possible diseases. Hopefully, this information will help you to be more proactive in caring for and protecting your health. Wish you always have good health and happiness.